Hi everyone, my name is Emily Brown and I am a physiotherapist from Edmonton, currently working in the private practice sector at Advantage Sport Medicine Physiotherapy. This presentation will outline a physiotherapy perspective of the management of hip osteoarthritis, or hip OA. Throughout the presentation, I'll be discussing the current research and guidelines regarding best physiotherapy practice and the management of hip OA. The following presentation is a summary of research findings with references included at the end of the presentation. To begin, the current research and guidelines point to various forms of first-line conservative management of hip OA. From the physiotherapy perspective, there are a few things that make up first-line conservative management. First, patient education, specifically in regards to the pathophysiology of osteoarthritis, the prognosis, and the importance of maintaining an active lifestyle. Next is exercise prescription, which consists of both aerobic as well as strength-based exercise. And then third, promotion of a healthy lifestyle, such as weight management if appropriate. The patient education component is super important, as often patients believe that exercise is to be avoided when they are in pain, when in fact we know that that is actually quite false. We will be getting into specific exercise prescription later in the presentation, but educating patients and ensuring understanding on the importance of exercise and strengthening is very important in providing effective treatment. Next, we are going to examine the effects of exercise prescription. In regards to exercise, current guidelines recommend exercise for reducing pain levels and improving physical function among people with symptomatic hip OA, regardless of the age of the patient, the structural disease severity, the functional status, or the pain levels. So long as this specific program is individualized to the patient, the research does support the integration of exercise in virtually all patients with hip OA. While strengthening timelines are not immediate and results take time and consistency, systematic reviews examining the effects of exercise found that following cessation of monitored treatment, reductions in pain levels and improvements in function and quality of life were sustained for at least 3 to 6 months, sometimes even for 2 years. While strengthening often comes to mind first when discussing exercise program, it is important to consider other important elements that are to be included in exercise prescriptions. With regards to specific exercise prescription, current guidelines recommend targeting not just muscular strength, but also mobility, balance, aerobic function, as well as functional stability. When it comes to specific guidelines and programs, various initiatives and exercise programs have been supported by the research. The GLAD program is one example of a program that has been widely recognized internationally. The GLAD program represents an evidence-based treatment plan for both hip and knee osteoarthritis. The program delivers patient education and neuromuscular exercise with the goal of implementing current clinical guidelines for OA into clinical care. Since its conception, the GLAD program has been seen to have significant impact on patient symptoms, physical function, decreasing the use of medication, and decreasing long-term disability. Now we are going to briefly discuss the specific exercise recommendations. So while there are multiple guidelines that are currently supported by the research, we will be mostly using the GLAD program as an example today, as it is one of the more widely recognized programs. The other guidelines, however, had very similar recommendations. The GLAD program, along with many other programs, recommend both hip strengthening as well as strengthening of neighboring areas such as the knee musculature and core musculature. Because of the kinetic chain idea, where neighboring joints and muscles have an effect on each other, it is super important to assess and treat areas above and below the hips to ensure optimal function, maximize joint stability, and promote optimal movement patterns amongst patients with hip osteoarthritis. Functional movement training, focusing on improving the ability to perform activities of daily living, is also an important focus. Assessing and improving, if necessary, the movements that become limited when an individual develops OA, such as stair climbing or performing sit-to stands, has been seen to help individuals return and or maintain their ability to maximize independence with activities of daily living. Essentially, even though the guidelines often give recommendations in terms of specific exercises, it is really important to also focus on functional exercises that will lead the patient to become and maintain independent within their activities of daily living. In addition to targeted strengthening, moderate amounts of physical activity equivalent to 150 minutes per week, a moderate intensity aerobic exercise has been proven to be sufficient in reducing pain and slowing the progression of OA symptoms. Regardless of the specifics of the program, exercise prescription is to be individualized to the person. Special consideration taking into account patient goals, their preference, as well as their capabilities is really important when creating a treatment program. What is really important here is to have careful consideration regarding patient preferences, as ultimately the patient is going to be compliant with the things that they enjoy doing and the things that they actually find meaningful. Throughout the course of treatment, parameters such as frequency, the duration of sessions, exercise intensity, and the number of sessions should be progressed. Clinicians should also monitor progression and trial different forms of exercise if improvements are not evident. So oftentimes, even though certain recommendations will be made in regards to specific exercise, it is really important that things are individualized and that the clinician is picking an exercise that has a desired outcome. Now that we've examined the recommendations regarding active-based treatment, let's discuss the use of passive treatment. The use of passive modalities is often discussed in the literature. There seems to be varying opinions on the effectiveness and the appropriate usage of passive interventions. In regard to passive treatment and manual therapy in the management of osteoarthritis, current research supports the use of short-term manual therapy, such as soft tissue release, as an adjunct to lifestyle management, in this case, active rehabilitation. In other words, depending on the individual, targeted manual therapy can be used to decrease pain, thereby decreasing potential pain barriers to engaging in active management strategies. Essentially, if pain is the number one barrier from a patient to engage in an active-based approach, finding a modality or manual therapy to decrease that pain would allow them to be more compliant with the exercise program. It is, however, important to understand that passive treatment does not offer long-term improvement if not properly paired with active treatment. It is merely found to foster engagement in active rehabilitation. With regards to manual therapy and passive modalities, it is also important to be cognizant of issues related to cost as well as to access of these treatments. While manual therapy has been seen to decrease pain and improve hip range of motion, thereby decreasing potential pain barriers to active rehabilitation, it is important to consider other symptom management options that could also allow for further participation of active treatments. These options may include medication and interventions, referral pathways, or psychological support. Due to the specific scope of physiotherapy, depending on the patient, it may be necessary at times to refer to other clinicians and address the individual's care from a more multidisciplinary approach. Depending on the case, the use of medications and/or interventions can have similar effects as manual therapy in decreasing pain levels and allowing patients to further engage in active rehabilitation without the exacerbation of their symptoms. The same applies to psychological support, which can address pain and disability from a psychosocial perspective, thereby creating a more supportive and successful environment for integrating exercise prescription. Due to the multifaceted nature of pain, it is important to create a multidisciplinary approach to symptom management when warranted in order to increase optimal outcomes. While certain cases can be effectively treated solely with physiotherapy, it is important to consider the roles of other healthcare providers and how their skill sets can benefit the patient's treatment plan and care. To conclude the presentation, the main takeaway is that the research currently indicates that if we're able to promote active management strategies and teach the individual how to cope with their pain and symptoms and increase their physical activity within the scope of physiotherapy or with the utilization of a multidisciplinary approach, individuals may actually experience a manageable and stable state of pain without worsening for years to come. And then finally, here we have a list of references that outlines the guidelines as well as the recommendations that are currently supported by the literature. Thank you.